The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days.
South Africa is the first country in Africa to impose a complete lockdown in response to Covid-19. And it did so despite having relatively few cases and no confirmed deaths yet. Why has the country taken such a strong stand so quickly?
The first case of coronavirus in South Africa.
Panic buying has set in.
A state of national disaster.
I'm Nabila, and like many of you, I'm working from home thanks to the coronavirus. Today we're going to take a look at South Africa and try to break down how the government and public health sector are managing the outbreak. As of the 24th of March, South Africa has 554 cases of coronavirus. Compared to other parts of the world that haven't locked down, the number of infections is still pretty low. But bear in mind that on the 26th of February, Italy had just 470 confirmed cases of coronavirus. And under a month later, more than 64,000 people have been tested positive and over 6,000 have died. Italy's hospitals are crumbling under the pressure. Would South Africa be able to cope with a similar outbreak?
This is why we are trying really, really hard to flatten that curve, because our health system will not cope. It will probably be similar to Italy's situation, where they will have to make some very difficult decisions on who gets what resource.
The government's unprecedented decision to shut down the country at great economic cost was influenced by the scary projections of what could happen if no drastic action was taken. There's a number of models that epidemiologists are using to project what the infection and fatality rates could be. Most of them are pretty basic right now, as the outbreak is only 4 months old and the models are changing as more data becomes available. But here's the one that the South African government was using last week. It models 3 scenarios. In the worst case scenario, if the government does nothing at all, 40% of the population would be infected. That's 22 million South Africans. 15 to 20% of them would require hospitalization. That's 4 million people. And in this model, 2% of all infected people would die. That's 351,000 people. This model's projection of fatalities, 2%, is much lower than others. Italy's current death rate is closing in on 10%. And South Africa has a unique set of challenges. Let's take a look at some of them. Five million people in South Africa live in informal settlements. Millions more live in densely populated areas, and a third of people live in multi-generational households, which could speed up transmission of the virus.
Social distancing for you and I, who are sitting at home working off our computers, who have a car to get into should we need to go to the grocery store, pick up what we need and come back, is far, far, far different from someone who has to go to work. Again, I said, if there's no work, no pay situation, who has to take public transit systems, and who might not have, access to sanitation and water.
One of the ways to slow down transmission of the virus is to encourage people to wash their hands and to socially distance. But that can pose a problem for many South Africans.
If you are living in an overcrowded community, if you have 5 people to 1 informal settlement housing structure, what does that mean if there is 1 room? We have a large portion of people not only with HIV and TB, but with non-communicable diseases such as diabetes, such as cancer.
The coronavirus isn't a death sentence for most people, but the elderly and those with underlying health conditions are most at risk. South Africa has a fairly young population, unlike places like Italy, but they have more people living with HIV/AIDS than any other country in the world. In the government's worst-case scenario, 200,000 people would need critical care. But there are only 3,000 critical care beds available in the country, and a limited number of medical staff.
It's not just about a bed, it's about having a doctor to see the patient, 24-hour nursing staff, equipment such as ventilators, medication.
So, will the lockdown be enough, and will South Africa be able to stop coronavirus?
This isn't only about me and my family. It's not about only your economic situation or your religion or your health. It really is about everyone. So in many ways, we need people to understand the measures that the government has put into place, abide by them stringently.
I call on all of us, one and all, to play our part and our role as South Africans, to be courageous, to be patient, and above all, to show solidarity and compassion to one another. Let us never despair despite the challenges that our country is facing now. For we are a nation of one, and we are surely going to prevail. May God protect our people.